Hi, good morning. My name's Jonathan Baillie. I'm editor of Health Estate Journal, the HEJ magazine, and I'm here on the first day of Healthcare Estates 2024 at Manchester Central with Sustainable Solution Sales Manager, UK, Ireland and Benelux, Paul Owen, from BeaconMedaes for a chat about some of the work that the company's particularly doing around sustainability. Paul, for the uninitiated, could you just give a bit of background on BeaconMedaes and your key activities
Yeah, of
in
course.
the healthcare sphere?
Yeah, so BeaconMedaes as a company have been around for a long, long time. We're the world's largest medical gas pipeline company. And traditionally, we've kind of delivered all the infrastructure, the plant, into the hospitals and the clinical areas. And we've recently taken on the distribution channel, so we can now distribute those gases via pendants into that.
That's new for this year, is
It
that
is.
right? And you're highlighting it here on your stand?
It's something we are proactively now talking about, yes. What then happened was that the NHS have their net zero policies, and within that, under scope 1, is the management of medical gases, so volatile theatre gases, the anaesthetic gases, and nitrous oxide in the
which is used in maternity quite a lot, I think, particularly, and as an anaesthetic generally.
Absolutely correct.
Yeah.
And I think if you look at where it's used, it focuses around burns units, endoscopy suites, paediatrics, A&E, ambulance service, and maternity. And I think maternity is kind of like the hot potatoes. And so we've partnered with a company called Medcare AB, who are a Swedish firm. And what that enables us to do is to actually capture all of the consumed nitrous oxide in the form of gas and air. And then we can take that back to the plant room via our AGSS system, and then we can break that down into nitrogen and oxygen. So we're taking a really what's considered a toxic gas. When you consider nitrous oxide, it exists in the atmosphere for about 114 years. It's roughly 298 times worse than carbon dioxide, and it's upwards and downwards. And by that,
in terms of global warming impact.
exactly. Yeah. But it doesn't only heat the planet, it also destroys the ozone layer. So it has this double whammy effect. So it's vital to manage how we sort of deal with that. And with our partners at Medcare, they created this solution. We've got that exclusive distribution.
Is this the central destruction unit?
That's the central destruction unit. Sitting side by side with that is our anaesthetic gas capture unit, which goes into operating theatres, and that captures all the volatile gases. So predominantly now we're talking like sevoflurane is going to be the big one. And again, that has a huge impact on the environment. So we can now capture that and deal with that. We've also got a dedicated system for leak detection. So what we've done is created a full package now for sustainability to sit alongside what we consider to be our core business.
And those gases, desflurane and sevoflurane, are both have a high global warming gas potential as well.
Really, really bad.
It's correct that they're trying to, the NHS and is trying to phase down the use of sevoflurane and desflurane where they can. Is that correct?
So, desflurane by and large has now been removed from use. I think when you look at the ramifications and the impact of it, it pretty much had to go. It's kind of ironic because our system would actually now remedy that completely harmless.
Sure.
So had we been in this a couple of years before we got to that point, we could actually have stopped that because it is a viable drug. There's a second one which is called isoflurane, which is used less and less now. Yeah. And I think by and large...
is that a chlorofluorocarbon as well?
Yes, it is.
Yeah.
And so in the main, I think if you look across Europe as well, where we're sort of taking this, BeaconMedaes is a global company, and so our other divisions are now launching these products. And what's happening here in the UK mirrors what's happening in Australia and throughout Europe, where everything's boiled down to sort of SIBO now. And that's where we're...
So is the UK more or less advanced than other European countries in this respect in dealing with these anaesthetic gases?
Well, when it comes to nitrous oxide or gas and air, I think we were probably a little bit behind the curve. Because I think if you look at what's been happening in the Nordics, for example, the central destruction unit is built in to all new hospitals. Every hospital that's built, it gets specified into it, and it exists as a tangible product. And it took us to bring this into the UK for that to actually happen. And our first installation was I think it was like 2.5 years ago. And you can see the results, because on the front of the destruction unit, you can actually physically see how much nitrous oxide has gone in, how much has been...
Where was that?
That's at the Newcastle RVI, up in the northeast.
Yeah.
They actually won the award for Sustainable Project of the Year last year,
Right.
Here at Healthcare Estates, for that particular project, because it had been so successful.
And some of these anaesthetic gases are not only obviously bad for the environment, but they're not good for the health of the clinical staff.
Absolutely.
I believe sort of long-term exposure can be quite bad for them.
Yeah.
And for patients, potentially, without the right technology in place.
Exactly. I think when it comes to patients, their level of exposure is not over a prolonged period of time.
Sure, but for the staff it would.
Staff is significant. So under the health and safety exec, there is a weighted time average limit, and that's 100 parts per million. And it's a fairly binary system of, do you breach that over an 8-hour period or don't you? So one of the things that we do, and with our partners from Medcare, we've actually got a monitoring system that we can provide the NHS, and we've got a testing facility where they can lease units to identify if they do have an exposure limit concern.
Yeah.
We can then, once we've identified if there's a problem, we can then sort of put those steps into place to remedy that. But I think in the past, nobody's come out directly and said, these are the ramifications of long-term exposure. But over the last 18 months, more and more people have been coming out. And there is now a definitive list of exposure hazard and risk. So obviously we're there to help staff and the environment.
With the drive of the NHS towards net zero carbon, presumably trusts are more and more conscious of this, or have become more and more conscious the impact of these gases over time.
Yes, absolutely. Yeah. There's been numerous studies carried out, independent, internal and external. And there has been a real shift, I think, over the last possibly 8 months. When I first started in September last year, this was very much a sustainability role. It was dealing with sustainability managers, estates people, working towards that net zero goal and how we can aid and assist. And what we've seen is a tangible shift towards health and safety. And as you've alluded to, where we've got this weighted time average, more and more hospitals have been alerted due to whether it's small rooms or poor ventilation or whatever it might be.
Yeah.
The shift is now towards a duty of care, because you have to look after your staff. And with sustainability, there is no magic pot of money. Obviously, these targets exist for the NHS, and it's up to them how they get there at the minute. So with sustainability, it's a nice to have and it's a target to get to. But when the hospitals identify that they've got a problem, it's a we must change.
And how conscious of NHS estates and facilities management teams and their healthcare engineers been of this issue for some time? Is it something they've become more aware of, or are they more well informed? Have they known about it for some years? I think
that there's been far more press and publication and awareness over the last sort of 24 to 18 months. That's been driven from the NHS and from a lot of these independent reviews on exposure levels. And I think as well, when you look at some of the reports on the impact in the environment, particularly when you've got, say, for example, desflurane, which off the top of my head, I think is about 6,000 odd times worse than carbon dioxide. That kind of drives that conversation.
Sure.
And what then happens is that then builds onto what other gases, and then the nitrous oxide scenario emerges. And I think there's been a tangible shift as well. When you change from desflurane to ISO to SIVO, it's called that. In the past, you've had nitrous oxide used as a carrier gas. So that's another use for a gas.
Sure, yeah.
Whereas you look now, a lot of places are using oxygen as a carrier gas. So nitrous oxide in its pure form is being phased out in that regard.
Yeah.
But as a general anaesthesia, because of its price and its availability, because you're a rapid uptake and a really quick drop-off, you're left with almost the perfect drug. For maternity, pediatrics, you don't absorb any of it.
Sure.
0.00%, but it's next to zero. So there is a huge conversation going on. It's gathering pace. And I think the gas and air scenario is growing because of the exposure to staff, but also if you can manage that through one of these systems. So if you install a central destruction unit, you connect all your birthing suites to it, You've now removed the exposure hazard for the staff, but in the same swoop, you've now also prevented that gas getting into the atmosphere. So it is a double whammy in that regard, and the big green tick comes at the end.
How easy has it been to engage clinical people, and particularly surgeons, in this argument? Because in the past, I should imagine some of them had, an anaesthetist had particular ways of working, and they favoured some of these anaesthetics for certain properties. Has it been hard to engage them in the carbon footprint argument?
Not at all. I think when you consider volatile gases in theatres, our solution for volatile gases in theatres is made not by Medcare, but by our own Atlas Copco company,
sure,
Class 1 based in Canada. So when we bring that in, we're actually dealing with the anaesthetist, and a lot of the senior decisions being made on sustainability is led in theatres by anaesthetists.
Right.
They're very keen to be doing the right thing.
Yeah.
When they lead it, we then deal with the states teams and sustainability managers. But there's a large group of sort of stakeholders that we have to engage with. And I think everybody within the NHS is driving towards this net zero. There's very little pushback. I think the only pushback that I think all of my colleagues that will be here today will say is the funding issue with NHS. That's the real holdback.
So is that a bit of a barrier here in terms of the original capital expenditure to buy this equipment, or are you able to be pretty persuasive about the benefits that you've explained?
I think the benefits are absolutely clear for everyone to see. We've got all the data. We've got independent sort of white papers been written on this. So when we have those conversations, there is no doubt about the efficacy of the product and the solutions. One of the stumbling blocks is obviously funding. Capital is a major issue. So one of the things that we've done as a company to help the NHS with that is to be able to put in a finance package that works alongside. So Seedale doesn't get impacted. So we can actually work.
Is that a leasing type of package? Or?
It is based on that. And it is one of the things that we will be talking about. We're just about to do a big launch in all the press. That's literally just, it's sort of about 2 weeks too early for us, Aheem, on that one. But breaking news, if you will. But yeah, so we've identified that there was this stumbling block. And the main reason is I think there's a lot of infrastructure work that has to be carried out. So it's not a £5,000 solution.
Sure.
We do require that kind of capability to be able to provide a lease, which we've gone out and done.
Were there considerable learnings for you as a company following COVID and the issues there with medical gases and oxygen generally in supply?
Well, one of the things that we were involved in heavily during COVID was supplying all of our existing customers and the people that relied on us daily. And I think for us, it was more about stepping away from things like the Nightingale to make sure that we could support our existing customers.
Sure.
Obviously, BeaconMedaes as a global brand and as part of Atlas Copco, we had the capability to supply to everyone that needed it. And I think for us as well, coming off the back of COVID, so much changed. Working practices changed, so less going out on the road, more Teams calls. We've continued to adopt that. As a business, we're very heavily concentrated, like through Atlas Copco, through all of the divisions, on our sustainability stance. And what we do as a business has to be projected outwards to the solutions we provide. And we've kind of carried that through. On our website, we've just put up our new carbon reduction policy and our social values policy, and that's now all there for everybody to see. And that again has been driven off the back of COVID and sort of employing locally wherever possible and kind of looking after the community.
So your role very much came out of this work, I think, didn't it? Some of this work, your role was created to champion this.
It was. So
can you tell me a bit about your background?
Yeah, so I've been in sales for far too long now, quite frankly. I think it goes back to when I was 19 and I started in London in 1991. So my background is historically in financial sales. It was all a bit of a strange leap for me, and then lived in the States for a little while and then came back to the UK. And I got into healthcare in 2018, I think it was. And I got involved in selling clinical equipment into the NHS. And you start to make a lot of friends and you get to people.
And you obviously enjoyed it, found it an interesting field to be in. It's very dynamic.
It is. And I think for me, it's more about being able to help the NHS. You feel like you've got a purpose in what you're doing.
Yeah.
Sometimes sales if you're in sales, it can feel like you're banging your head against a wall sometimes.
Sure.
But with this, you actually genuinely feel like you're doing something different. I was then approached for this role to see if it was something that I would be interested in. I know of BeaconMedaes, my previous company. I worked with them extensively. So it was for me, it was the perfect fit, perfect opportunity. It gave me a platform to do something that was new. It was exciting. It was very, very topical. And it was something that had kind of started. My colleague, Mark Lakey, had kind of led the charge with this. And it got to the point where his own job was starting to be impacted by the amount of work and time he had to put into this.
Sure.
So it was at that point they thought, right, no, we need to get somebody in. So that's when I started, and it's been a journey.
So do you spend a lot of your time on the road at hospitals talking about these issues particularly? And do you have any other sort of support on the sustainability sales side?
Right. So on the back of COVID, as I've mentioned, we try and limit how much driving we do.
Okay, that makes sense, yeah.
We're a very sustainable-based company. So for us, I'd far rather not be on the road because you consume time. So our primary focus in the initial discussions is all over Teams. Just the good old-fashioned cold call is not dead. So we kind of go through that process. We have a number of meetings. We engage with various different stakeholders on Teams. We do require a survey. And that's when I then get involved. And if we have to present a sort of senior level when we're giving full presentations, that's when you go out and do that. Now, I obviously cover a national role. I've got colleagues who cover regional roles that do the installation business.
Sure.
So because they're regionally based, if there's a quick drop-in, they do that rather than me traipse all around the country. So
sure.
We work very much as a team. I've got 4 regional colleagues. And where they kind of generate interest, and I then pick up on that and run with that. And as a team, we don't just provide sort of sustainable solutions. It's the broader package where they get involved. So yeah, it's very much a team effort.
Is it right that you're using, as a company, you're using 3D printing now to produce sort of models of some of the equipment? That's quite an exciting development. How new is that? Is that driven by Atlas Copco or?
No, it was. We're actually. So yes, you're absolutely right. We have, and on our stand, we've got our first one. It was actually at IPEAN last year. I was sat with one of my colleagues because the CDU is the size of an American fridge, and a double door.
It's not something that's
we can't just wheel it in and wheel it out. No. And quite frankly, it looks like the fridge, and it's quite hard to build enthusiasm for just a big static piece of kit. So what we decided to do, sat around the table on the stand, was to see if we could create 3D models. So we ended up as a business investing in a state-of-the-art 3D printer. We've now done the first one as like a test bed. That's our CDU installation. And we're now going to be doing them for medical pendants. We're going to be doing them for all of our plant, so that when we go for meetings, we can stick it in a suitcase and we can actually take it in and give people a physical idea of a better understanding.
That must be extremely useful in terms of footprint and design and configuration.
Yeah, I mean, one of the things about BeaconMedaes, we are BIM Level 2 compliant for all of our projects. So when it comes to designing projects, we can drop all of this into the drawings.
Yeah.
So for us, it's just another example of investing
using technology.
Investing in technology to help.
Sure. Am I right in thinking that you have a new range of products launched here as well, medical gas pendants?
We do. It's
and that's something that's being shown here for the first time?
So we don't have any to show,
okay.
But it's the first time we're publicly talking about it.
What's led to their introduction?
So as a medical gas pipeline supplier, predominantly you provide the plant, the carcass, and then you end when you get to the sort of the clinical interface. Somebody else then provides the pendants. For us, it was a natural transition. What we've done is we've actually bought a company who manufactures pendants. They've now become part of BeaconMedaes. And so we've just completed our first installation in the Northeast. That went out on LinkedIn as a big celebration.
Where was that?
That's at the RVI in Newcastle.
Yeah,
yes.
Yeah. Well, I know they have quite a pioneering record on net zero carbon.
They absolutely.
They have a very good sustainability manager there.
They do. Yeah. It's I think the RVI is really at the forefront. They've really grasped sort of technology and where to move with this. And for us, I live in the northeast. We've got an office just outside of Newcastle.
Okay.
So for us, they are one of our sort of local hospitals. Obviously, our head office is in Derbyshire, but we have a satellite sales office up there. So they're on our doorstep. So it's been very much a case of working with them. So for us, getting pendants was the next stage of supplying all the plant, all the gases into theatres, then distributing them, and then I come along, capture and take them back out again. So we've got a nice swoosh.
As a company best known for sort of medical gas expertise, do you think you now among your competitors, and I realise quite a specialist area, you must have one of the most comprehensive packages of equipment in this area, I guess?
Yeah.
Particularly with the anaesthetic gas scavenging and CDU, etc.
Yeah, I mean, we are in a very competitive market. And we've got some outstanding competitors that we go up against. We know them very well. And it's one of those rare occasions where it's a privilege to operate in that same environment where you know all your competitors, because by and large, a lot of them have actually worked for BeaconMedaes. When you actually trace back their history, they've all sort of moved on.
Yeah.
So it's a small sort of concentrated market, and everybody knows everybody else. When it comes to where we sit right now, we decided that our business model had to change to move with the times and technologies and the requirements of the NHS. So we took that, and that was our impetus to move towards the capture and processing technologies like the CDU, like the HDR for theatre gases. And then we threw in the pendants. And as far as I'm aware, none of our competitors are offering distribution networks through medical gas pendants, maybe through bedhead trunking, but not Class 2B pendants. And then nobody else is providing the capture systems that we do. So it puts us on a different level.
You must have had a very exciting year or so here, in the job, and certainly very busy.
Yeah.
I wish you well with it. And if people are interested in coming along and talking to you and colleagues about BeaconMedaes products and systems, which stand are you on here?
So we're on stand A4.
Okay.
As they walk through the door, hang a left, and we're the big one there.
They're in a good position there.
We are. And we've also got Simon Lewis from Medclaire as well, who's here to answer any other questions as well. So if anyone wants to pick up on that, they're more than welcome.
Thanks very much, Paul, for talking to me.
My pleasure.
Very interesting and really exciting times to BeaconMedaes.
Thank you very much for having me.
Cheers.
Cheers.
Thank you.